Welcome to this very, very interesting session that we're having today that is very timely, whether in war or in peace, because we have commercial actors without us knowing, without them being seen, interfering and taking advantage of war and peace to move ahead their agendas and their profits. Today we have 3 speakers. I will start off myself, Jihad Makhoul from the Department of Health Promotion, Community Health. We have then Mr. Tom Gatehouse, who is supposed to be joining us from the UK. He's a research associate from the University of Bath in the UK. And we have Dr. Lara Nasreddine coming from the Faculty of Agriculture, Food Sciences today from AUB. I will start off myself with a quick overview of commercial determinants of health, and then I will continue talking a little bit about the arms industry. And after that, we'll have the rest of the panels, and I hope Tom is able to join. Mohammed, will you be able to see if Tom joins? And then Dr. Nasreddine will end. And we hope to have some time for discussion and Q&A at the end. Tom, this is a very interesting day for me because we already had great. We already had a quick discussion today, a session actually for the University for Seniors today at 10 o'clock. And also on the commercial determinants of health. But this is a different thing. Okay. Tamam? Yes. All right. Can I? Yeah. Thank you very much. All right. Okay. So the corporate capture of public health, the capture of public health by commercial actors during times of war and crisis. So a very quick overview, but first of all, let me just say a few words very quickly about the network that I am a member of, which is the GCAN network, which is the Global Commercial Determinants of Health Action Network. If you're interested to join, you can. It's a group of individuals from all over the world who are interested in advocating and conducting research on commercial determinants, and supporting and connecting with advocacy groups to conduct more research and action on the commercial actors all over the world. We do a lot of activities, we do webinars, we have research groups, we have collaborations, we present panels in international conferences. There is an online course as well. And so if you become a member, that means you become part of the network. You have access to our meetings. We share publications. This network was actually established in 2018 at the Faculty of Health Sciences. And you can actually check out the website in the FHS webpage. If you're interested to become a member, please let me know. But also you can email the Secretariat. So let's have a quick overview of the arms of the commercial determinants of health. But I want to just get a feel. I don't know if we can see this also in the people who are joining us online. How confident are you in explaining what commercial determinants of health mean to your professional networks? And the majority of the participants here are our students, and so we're going to have sort of like a sway towards the yes, I hope. How confident? Are you very confident? Who's very confident in explaining what commercial determinants of health means? Okay. Somewhat confident? Somewhat confident, okay. Not at all? Okay, fantastic, great. So I know I have now an understanding of the participants. Would you be interested in joining a research group on the commercial determinants of health? And this is my dream come true at AUB. Yes? Oh, wow. Okay. Perhaps? Okay, great. What do we mean by the commercial determinants of health? This is the Ronald McDonald in the AUB MC Children's Cancer Center. Commercial determinants of health are the industries and the systems that include not just the products, but also the actors themselves and the support systems that they include to market their products and connect all around the world, to influence health, to influence health and make profits. They involve themselves and they have something called a corporate playbook, which we will see in a minute. These are sophisticated strategies that seem to cut across all the industries, regardless of what the industry is. And what's interesting also to see is that one outcome of the commercial actors all around the world is the privatization of the public goods that are supposed to be publicly available for everybody, like healthcare, like education, like defense, and others. These are just some examples of the commercial determinants of these industries that we are talking about today. And underneath each one are just some examples of the harms that they have on public health. So you have the arms industry, the food and beverage industry, the textile industry, the gambling industry, the agribusiness, fossil fuel industry, global internet technology, and the pharma industry. All of these are just some examples of industries and some examples of the adverse impacts that they have on health and the natural environment. So these industries are transnational in nature. They span many countries. They're not situated in one place only, but they do have parent enterprises in specific places of the global north, for example. Currently, there are more than 100,000 transnational corporations. Of course, they are part of economic growth. They are engines of economic growth because of the foreign direct investment that flow into countries. Some of them are easy to identify, like the tobacco and the alcohol. Some seem to be even health promoting, like the fruit and the beverage industry, and the renewable energy industry. And some are a mix, and they produce water, sugary beverages. Water is good, sugary beverages is problematic for health. And some have indirect effects on health. You wouldn't see it, like the internet technology, like the fossil fuel industry, especially if they are maintaining a corporate social responsibility strategy. If you look at this very quickly, you can see this is the global top countries and corporations, where some corporations, like for example, Walmart, which is a retail industry, has a revenue even more than some countries, more than the GDP of some countries. So they're very, very wealthy and very powerful. Very quickly, the strategy. So what do they do? There's something called the corporate playbook. It's like what they do, the strategies and the tactics that are common across all industries. And these are many, I just chose 10. And each one of those can be a paper by itself and can be a whole session by itself, but actually they are involved in, of course, producing health harming products, involved in health harming practices, They have a revolving door strategy, like one person from this organization, from this industry, has also a dual role in a government, so they affect policy making. They mold culture and social norms, like, for example, the alcohol industry that now maintains that alcohol has to be there in festivities. They operate in low-income countries of the world where regulation is weak, and they frame problems with focusing on individuals, not on the commercial actors themselves. They harass whistleblowers who go against or who highlight their adverse practices, and they diverge attention from the problem itself by creating an alternative understanding or a perspective of the issue. And it's called, like, for example, the silencer effect, publishing rebuttals and challenging research that bring out false information and problems that they have created. They create credibility by engaging with private sector NGOs, but also universities, like the pharma industry, like the food industry. And there are many examples here at AUB how corporate social responsibility manifests itself with support for research and practice at the university. Last but not least, they convey themselves as part of the solution, like the fossil fuel industry recently was talking about, how they are creating energy efficient solutions rather than polluting the sea and the environment in their practices. And this is, we'll come back to this later on, the SDGs, which is a set of 17 goals, and each one of them has several targets that the UN put together in 2015 towards improved goals for the world at the level of the environment and public health. So this is a very quick overview of the commercial determinants of health. I will now move very quickly to the arms industry. The arms industry as a commercial determinant of health. Before wars, during wars, and after wars. So the arms industry is different from the firearms industry. The arms industry is an international enterprise that involves multiple players that produce, market, and sell ammunition and weapons to warring factions and to governments all around the world. So there's a big element of trade there. It invests a lot in research and development to improve the weapons that they are producing, to sell them to various countries. And they actually involve other non-state entities that support them in terms of marketing, the financing, trade, and others. And so then several companies get together with non-state actors such as militias, and we would refer this as the defense industry. Now, then the arms industry is different from the firearms industry. I'm going to talk about the firearms industry. There's a lot of research, not too much research on the firearms industry, but this is about the individually held or revolvers, shotguns, rifles that you find with individual people. This presentation is very important because when we think about public health, war is an important public health issue. We don't really think about war as an important issue unless war happens and we think about the casualties and how to respond and how to rebuild. But when we think about war as a public health issue, then every public health issue, okay, needs to be addressed from a prevention perspective. And for us to prevent war, we need to have a good understanding of the elements or the determinants that fuel war. And one important one is the arms industry. And there's not a lot of research that's been done on the arms industry. We need more research on this for us to produce evidence to support advocacy and policy making to prevent war and not just respond to war when it happens. There's something called the war industry, and in the literature, it is used interchangeably with the arms industry. So when you talk about the war industry, you talk about the arms industry. So they are used interchangeably, and this is the system that creates conditions for and maintains the ability and the capacity to wage war. So it does include the arms industry. And so one would think that the arms industry plays an important role in supplying governments with ammunition, with weapons to protect itself and its civilians from, outside attackers or whether they be other states or other groups. However, and also it's seen as important and essential then for national security. It also establishes a dependence and creates alliances between countries when we talk about a trade. But also, if you look at it from the other perspective, the arms industry doesn't really enhance national security. What it really does is it has increased financial profits. It doesn't really accomplish its primary objective. So contrary to what one would think, the arms industry is for profit. If you look at this is a very interesting multi-causation web. If you look at the middle, there's war and conflict, whether it's interstate or internal. And you see it is part of a very interesting web of causation where multiple actors play a very important role in producing war. And see at the top you have on the right, there's the war industry and the government's decisions and the military. And they're all interacting together. And these are some of the underlying root causes of war. And of course, the war has its effect on the environment and people. And there's also a very important aspect of it is the media that influences the decisions and the outcomes of war. So if we look at the strategies and the tactics of the arms industry, they're very, very similar to the strategies and the tactics of other commercial actors, as we saw a moment ago. And what was interesting here is the stress that there is very much of lobbying and interference in policy making and exerting political influence through, for example, spending a lot of money on elections. For example, here, the US Defense Aerospace spent a lot of money in the 2024 elections. And this is a very interesting website called Open Secrets that I found. It also frames military intervention as the only necessary intervention that is possible, and then that creates a demand for its products. And of course, it enforces censorship on journalism. And we've seen this from the recent war in Gaza and in Lebanon. Definitely, there are adverse impacts on public health, and we won't go into detail of it. We know that it causes wars from, fueled by the arms industry, causes significant death, disability, destruction, trauma, infectious disease spread, congenital birth defects, depending on the weapons that are being used. And of course, the war on Gaza is a perfect example, not so perfect, but an example of how the war effects have devastating impact on people, infrastructure, and the environment. Another example is the chemical weapons that were used in 1988 in Iraqi Kurdistan, which resulted in multiple significant health impacts for people, including children. And of course, the current civil war in Sudan that uses actually artillery and weapons from here and there because of the to support the warring factions within. There's something we sometimes tend to forget are the explosive remnants of war, the mines and the unexploded ordnance that are left after the war that tend to kill farmers and children and a lot of people. And they are still available in many countries around the world because they are unexploded. And these are just some examples. And here at the end, here, this is in the war, in the 2006 war, we had a lot of unexploded ordnance all around Lebanon. And then the army came in and had a little bit of a demining exercise, but we can still see a lot. And this is 2006. And of course, now you would expect that there is still a lot of unexploded ordnance in Lebanon after the recent Israeli war. Of course, there are environmental impacts on from the arms industry because of the upgrading and testing of the weapons, because of the contamination to the ground when the weapons are being used, and the landmines that when explode cause a lot of damage, but also wildfires and environmental destruction and increase greenhouse gas pollution. Even after the war, which is interesting to see, is that post-war reconstruction also emits a lot of greenhouse gases, as you can see here in the reconstruction of Gaza, that is estimated to require millions of tons of carbon dioxide. This is another example of what you do with the tanks and the weapons that are, left after a war. One last point is a very important point. How do these weapons get across from one place to another, from the producers to the users? So here, this is we have something called the arms trade, which is actually the movement of arms from one place to another, export, import, whether it's legal or illegal, through gifts, sales, the black market, or the formal market, creating markets for themselves in places where there is war and where there is a possibility to wage war when the conditions are ripe. And we are in the Middle East and Asia the most consumers of the arms weapons, and we are the main arms importers, according to the Stockholm Institute for Research on this. Over the last 8 years, billions of dollars have been spent on arms trade, which exceeds many, many times the amount spent on the SDGs all around. If you have a look at the arms companies making the most profit, the top ones are situated in the US, Russia, and China, and the UK. War profiteering is the excessive gains from selling arms by non-state actors. And this is, for example, how ExxonMobil and Chevron made enormous profit from the war in Ukraine and continue to do that. But also years after the war on Iraq, you still have the fossil fuel industries making a lot of revenues from that, and that's called war profiteering. Unfortunately, the Arms Trade Treaty, which is the sort of like the most important one that establishes universal regulations for global arms trade, is that limits or that prohibits the sale of arms in places where there is possibility of breaches in the Geneva Convention and the possibility of other war crimes. This has limitations because it lacks enforcement. It's interesting to see in the Middle East, for example, that 5 of the 10 countries globally that have the highest level of militarization fall in our parts of the world. And the number one over many years is, of course, Israel, ranking the first in global militarization since 2007. There has been significant military aid to Israel. We know that, and there's a lot of money being spent, and also money still coming in for tank ammunition, artillery, guided munitions, and other things. The last point I would like to just say is that there are a lot of breaches in public health ethics when we talk about the arms industry, its trade, and its tactics. Well, first of all, they have exhibitions in countries that are very low, middle income countries. Here, so for example, there's one in Nigeria that is already low income, suffers from hunger, and has a lot of health problems. Arms dealers witnessing record profit from sales for Gaza, for example, how they come in and do corporate social responsibility and support research in universities, so the influence in universities there, and the recent emerging disruptive technologies such as drones that have been used in Lebanon and all over the world to target individual civilians, and of course the lethal force being used by the governments themselves against their own public. So in short, in conclusion, the arms industry is a commercial determinant of health because of its destruction and its impact on human lives and the environment. And it has a high burden of death and disability because its weapons or its products are used as intended. So we need to do a lot more research to understand the tactics, and we need to be able to use this research to prevent war and promote peace. And thank you very much for listening. This is coming from a paper that a couple of my wonderful students and I and Naisan Mani are now resubmit to PLSO Global Public Health. All right, so next is we're going to have Tom. Tom, are you with us?
I'm here.
Tom?
Hello?
Hi, okay. There you go.
Can you hear me?
Yes.
Okay, perfect.
فادي كيف أنا نعمل full screen. Tom Gatehouse is a research associate from Bath University in the UK. Tom, the floor is yours.
Okay, thank you, Judy, and thanks to the American University of Beirut for the invitation. I'm just going to share my screen. So, yeah, can you see that? Can you see my presentation?
We can see it, but not on the screen.
You can see your notes.
Okay. All right, hang on, I'm not sure how to sort that out.
Don't worry, we'll try to do it here. Uh, Renan. Okay, great, thank you.
All good?
Yes.
Okay. Okay, yes. So I'm a researcher at Tobacco Tactics within the Tobacco Control Research Group at the University of Bath. And my presentation today is called Confronting a Double Crisis, Tobacco in Conflict Zones. So the aim of the presentation is to discuss the tobacco industry's close relationship with war and conflict, showing how it's used conflicts historically to expand its markets, and how it can...
I'm sorry to interrupt, Tom, but we are currently seeing your notes. Can you please just
full screen
to the presentation?
Slideshow, full screen.
Okay, one sec.
Yes.
Yes, that's better.
Thank you. Fantastic.
Okay. So yeah, I'm going to talk a bit about how the industry uses war and conflict to expand, to maintain and even expand its profits, with some historical examples. So here's my conflict of interest declaration. So I have no financial conflict of interest, and the TCRG does not take any money from tobacco or any other commercial organizations which are harmful to public health. So first of all, I'd like to start by just giving you a bit of historical context. So the tobacco industry, it's had a long relationship with war, and it's really the two world wars which consolidated the tobacco industry as we know it today and contributed to the rise of the cigarette as the dominant form of smoking tobacco. So World War I really helped to popularize the cigarette like no other global event, and World War II only accelerated this process further. So tobacco products were included in soldiers' rations in both World War I and World War II, and governments and military authorities of the period encouraged smoking amongst soldiers as a means of combating stress and helping them to maintain their cool, if you like, you know, under the pressure and the danger of the battlefield. So during this period, particularly during World War II, cigarettes were cheap and consumption increased massively. Many soldiers continued smoking after demobilization, and smoking rates also increased during the civilian population in this period, in part a result, of course, of the stress and the tension and the trauma associated with war. Also in this period, we see the expansion and the increasing sophistication of tobacco industry advertising, which heavily exploited the war effort. So tobacco advertising of this period, particularly in World War II, it featured pictures of military personnel, so soldiers in uniform and also on military operations, pictured smoking with cigarettes in their mouths or between their fingers. One other interesting thing we see during this period, particularly in the ads from World War II, less so in World War I, is the first images of women smoking in tobacco advertising. So in the interwar period, women had increasingly taken up smoking as a result of social change and also targeted advertising by the tobacco industry. So I think by the start of World War II, around a third of American women smoked. And during World War II, in advertising from this period, women are featured smoking. As you can see in the image on the slide here, which is a Philip Morris advert for Marlboro from 1944. So tobacco industry advertising was really very clever because it associated smoking with kind of bravery and heroism and patriotism of the war effort, but then also it featured pictures of soldiers coming home to their families, to their wives. So it also associated smoking with kind of the security and the comfort yeah, the kind of the coziness of home. So I'm going to jump ahead a bit in time now, 80 years in fact, and talk a bit about how some of these tactics are still being used by the industry today. Before I do that, I'd just like to flag that most of this presentation is going to focus on Ukraine. Of course, there are other conflicts ongoing in the world today, as we know, in which the tobacco industry has used these sorts of tactics and exploited these situations for its own gain. However, data is much easier to come by on Ukraine than in some of these other contexts, which of course is a reflection of inequalities in how the global public health community responds to these sorts of crises, and also of course political biases in media coverage. So in Ukraine, we've seen that the tobacco industry is still seeking to profit from conflict. So in 2022, Ukrainian soldiers trained in the UK were given free cigarettes, e-cigarettes and nicotine pouches as part of their rations. So this donation was made by an as yet unnamed transnational tobacco company, and the products were imported into the UK duty-free for the Ukrainian recruits. Also in 2022, Philip Morris International and Japan Tobacco International provided free cigarettes to Ukrainian soldiers in Ukraine. Of course, war can also disrupt the tobacco industry. So in 2022, PMI was forced to suspend its production in Ukraine because its main manufacturing facility was located in an area in eastern Ukraine, which was affected by the conflict. But still, it continued to supply cigarettes to the country from a series of factories located outside Ukraine's borders, and then also by striking a deal with Imperial Brands for use of its manufacturing facilities in Kiev. So you can see how even in times of war and even when its operations have been directly affected, the tobacco industry is very resourceful, and it usually manages to find ways of ensuring that its cigarettes continue to flow. Then last year, PMI opened a new $30 million factory in Western Ukraine, far from the conflict zone. So PMI, perhaps more so than any of the other big tobacco companies, it likes to portray itself as going smoke-free. In other words, it likes to claim that it's phasing out sales of conventional tobacco products, mainly cigarettes, and transitioning towards newer products which are supposedly less harmful to health. But we can see in Ukraine how its whole activity really belies this narrative, because before the conflict in Ukraine, PMI was the market leader in the country. In 2022, it lost that position to British American Tobacco. But since then, it's been determined to recover the ground that it's lost, as you can see from these actions. Also in 2024, Japan Tobacco International announced a new $60 million investment in Ukraine related to its heated tobacco products. So through these kinds of investments and also through corporate social responsibility initiatives, the tobacco industry has really sought to position itself as an ally of Ukraine. However, at the same time as it's kind of claiming common cause with Ukraine and expressing solidarity, the tobacco industry continues to operate in Russia, paying billions of dollars in taxes to the Russian state. So in 2023, Ukraine declared PMI and JTI international sponsors of war. So the Ukrainian National Agency on Corruption Prevention, it has a kind of blacklist on which it puts multinational companies which are still operating in Russia The aim is to denounce them and to reduce Russia's ability to wage war, by receiving tax contributions from these companies. So in 2022 and 2023, PMI and JTI were the top two multinationals operating in Russia by revenue. So yeah, this graphic was produced by Life Advocacy Center, which is a Ukrainian public health NGO. I think it speaks for itself. So although PMI, not so much JTI, but PMI, after the conflict erupted in 2022, it said that it was going to leave Russia. However, both companies are still operating in Russia today. Russia is a key market for the tobacco industry, and particularly for PMI. It's its second largest market after Indonesia, and Russia accounts for 17% of sales of its flagship heated tobacco product, IQOS. So the tax contributions by these companies to the Russian state far outweigh their humanitarian aid to Ukraine. So for example, in 2022, PMI contributed $10 million to international humanitarian aid for Ukraine. In the very same year, it paid $206 million in profit taxes to Russia. So globally, the tobacco industry it's a master of identifying an opportunity in crisis. And we can see this sort of similar dynamic play out in other countries across the world. So, for example, in Lebanon, I recently read news that both PMI and also Imperial Brands had been participating in recent corporate social responsibility efforts led by the Regie, aimed at helping communities in southern Lebanon, which had been affected by the war with Israel. At the same time, PMI has been the market leader in Israel since at least 2014. So, you know, just like in Russia, we see the company kind of playing both sides here. Presumably, PMI is also a major tax contributor in Israel, although I don't have specific data on its tax contributions today. In 2017, leaked documents and whistleblower testimony revealed how British American Tobacco had targeted countries in Africa affected by conflict, including Somalia, South Sudan, and the Democratic Republic of Congo. And today, British American Tobacco is still up to the same tricks. So just last year, it lobbied the government of Pakistan for export of what we call kiddie packs to Sudan. So kiddie packs, they are packs of 10 cigarettes, which are more accessible to children and other people of low purchasing power. So this was British American Tobacco's Pakistani subsidiary lobbying the government there for an exemption to its rules on manufacture and sale of kiddie packs so that it could export them to Sudan, which, as Judy mentioned, has been in a state of civil war for the last year and a half. And here you have some of the reporting in the global media on this. So although I think the Pakistani government resisted British American Tobacco's request, BAT just took the same request to Bangladesh, which looks like it's going to comply with this. I also received intelligence yesterday that actually Pakistan may be changing its mind. So either way, it looks like this export order of the small packs to Sudan is going to go ahead. So just some final thoughts. So war creates challenges for the tobacco industry. It's not necessarily a good thing. Like any other industry, war implies, for the tobacco industry, war implies disruption to its supply chains and its operations, perhaps destruction of its infrastructure, factories and so on, and maybe even physical harm to its staff. But as we've seen, the tobacco industry is extremely resourceful and good at spotting opportunities in a crisis. So for countries in states of emergency and crisis, tobacco control is usually a secondary concern. At the same time, war contributes to poor mental health. It creates stress, trauma, anxiety, all of which contribute to greater rates of tobacco use. Conflict also opens up opportunities for illicit trade. So this allows tobacco companies to establish their products in a country at very low cost and create a demand for their products before a company stabilizes and formalizes and begins to properly regulate its products. And as we've seen in the examples here, the tobacco industry is in general non-partisan. So it's happy to do business with both sides of a conflict. So the attacker and the attacked, the invader and the invaded. And it's continued to operate in situations of war, and of the most egregious human rights violations, dictatorship, and so on. Its only guiding principle and real motive is always profit. So countries in situations of war and other emergency situations need support in order to protect and advance tobacco control. This should come from the international tobacco control community, the Conference of the Parties to the WHO FCTC, the Global Tobacco Control Treaty, civil society organizations, and others. And this might sound tough or perhaps even unrealistic, but it can be done. And just to finish, I'll refer back to Ukraine, which in early 2022, so right on the eve of the Russian invasion, it passed a comprehensive new tobacco control law. And kind of against all the odds, it has managed to implement this law effectively and to enforce it in the areas of Ukraine which the government still controls. And this has been done thanks to strong political will from within the Ukrainian government, support from local civil society and global civil society, and international partners. So yeah, I'm going to leave it there. Thanks very much, and I'll be very happy to answer any questions you might have.
Thank you very much, Tom, for your contribution and joining us from the UK today. Okay, thank you very much for that. We'll have our last speaker, Dr. Lara Nasreddine.
Yeah, and the presentation, where is it? Yeah. All right. Hello, everyone. Hope we're not gonna delay you much. So I'm gonna jump to a totally different topic, which is diet, foods. Again, amidst wars and what could be the implications of this on the health of the population. So I will focus on what we call ultra-processed food. But before doing that, let's visit a little bit the concept of food processing and what it means. So food processing is the alteration of food from its whole natural state. Why? In order to improve its storage, its safety, its convenience, and its palatability. Of course, not any food processing is actually a bad idea or harmful. You know, processing helped us to improve the shelf life of food, the microbiological safety of food, enhance the availability of food for the population. But what matters is probably the extent and the nature of the processing that food is subjected to. So this brings us to, you know, a commonly used food classification system called the NOVA food classification. It has been developed by the University of Sao Paulo to classify foods based on their degree of food processing, and it gained a lot of popularity, you know, in the literature. According to this, you actually classify foods into 4 different groups based on the nature and extent of food processing. The first one is the unprocessed or minimally processed foods. That really includes most of our fresh food produce, but also minimally processed foods like, for example, low-fat milk. Group 2 is usually what we call processed culinary ingredients that we use when we're cooking, a bit of salt, a bit of oil. So they are processed, but they're not consumed in very big quantities. The third group is processed foods. These are foods that have undergone certain degree of processing, but where the food matrix is still intact. So, for example, canned beans, canned fool, canned hummus, they have undergone some kind of processing, but still the food matrix is still there. Group 4, the one I'm gonna really focus on, is what we call ultra-processed food and drink, or UPF for short. And the definition of this is that ultra-processed foods are formulated mostly or entirely from ingredients and typically contain no whole foods. So really the food matrix itself is not there. It's a combination of ingredients that you add together to things that are already, little food, as we know, food. And the purpose of these ultra-processed foods, why do they make them? Why is it popular in the food industry? Because it's durable, it's convenient. You don't need a fridge, you don't need any kind of safety measures or of preparation. They're ready for consumption. They're highly palatable, even to the extent of being potentially addictive. And they're definitely profitable because they are very cheap. People take them as a snack, sometimes even, as a meal for some aspects of these foods. So numerically, proportion-wise, the great majority, okay, right? صح؟ لأنه عم بقول restart now. Okay. So the great majority of the ingredients in these ultra-processed foods are additives, are emulsifiers, are bulkers, sweeteners, sensory enhancers, like I said, emulsifiers, bulkers. So they really have, if you have bought any packaged ultra-processed food and you look at the list of ingredients, you would look at them and I'm sure you will not know most of these ingredients, what they are. Hydrolyzed protein, hydrolyzed oils, lecithin, other kind of, funny names. They give flavor, they give bulking, they give colors, all of these that make the food attractive. So it is inferred, it is assumed that as a consequence of the ultra-processing of foods, which includes, first of all, the composition, that mix of ingredients when it was produced, the methods of processing itself, such as, for example, adding hydrogenated oils, which are not healthy. And again, the retailing of the final product, the retailing which relies on a lot of advertisement and marketing and smart placement in the supermarket, all of these together makes the consumer faced with cheap food that are high in fat, sugar, and salt, which are mass-produced, are designed for a long shelf life, and are quasi-addictive and heavily advertised. So, okay, how do we do that? من الزوم. وين الزوم؟
هو زوم ولا ويباكس؟
ما بعرف. ويباكس. Share. Entire screen بركي. window. Okay. هيدي. All right. Fine. So, the consumption of ultra-processed food is a concern everywhere now in the world. It has started to be a main concern first in developed countries as the production of these has increased, but it has also become a very important issue in our part of the world, in developing countries, in Lebanon, in the Middle East, where we say that we are undergoing a nutrition transition. So our diet is actually shifting from traditional to globalized or westernized, and the consumption of these has increased. And there are issues that we're going to discuss why this is a problem. But what could be, so it is an issue everywhere, but why is it of relevance to war and conflict is what I'm going to try to talk about in the rest of the presentation. Before that, so can you guess examples of ultra-processed foods that come to mind, you know, that we have used during or relied on or stored during our extensive experience with wars in Lebanon? Something that comes to mind from like people from my generation, what was, for example, the emergency bag? Sunflower oil. Yeah, this is a culinary ingredient, so it's not a very big deal. Processed cheese, that صح, we used to have a lot of that. What else comes to mind? Powdered milk, processed meat, هيدا الcorned beef. Yeah, we used to have this as a backup all the time. So populations who are faced with the threat of food scarcity, or who are at the risk of being displaced everywhere, where they can't cook, they can't, you know, have access to clean water, they might rely on these foods for survival, you know, because they just carry them, they don't require any preparation, they're easily accessible, they're cheap, they're convenient, and you would actually have them as your, you know, survival plan. And this is why the consumption of these foods might become very problematic in areas where you have such disruption in your daily life. So I'm going to quickly talk about, although we don't have lots of data about what's going on in Gaza, but I'm going to try to, you know, extrapolate some of the findings we have to, you know, try to understand a little bit what's happening there. So first of all, as in any war, the devastation in Gaza has crippled the food system. There is no food supply system. There is no food system. Everything, there is no agricultural produce. Everything as we know it of what makes the food system has actually been completely broken down. So the population might rely increasingly on these ultra-processed foods for survival. So an interesting article that was published in October 2024 looked at the composition and caloric value of foods that are arriving within the trucks and a little bit of modeling around this data. And although we don't have the fine details of this, we have at least the big categories. So what is shown in the yellow, the big one, is actually the cereals and baked goods. So cereals and baked goods, what could baked goods include? It could include cakes and biscuits and croissant. These are things that are already packaged. So it's not, you know, the fresh bread that will die in a couple of days. So it is like a very big chunk. So we can only assume that at least part of this will include things that are ultra processed. You can see also somewhere the sugar and confectioneries, which are definitely ultra processed. You can see also the specialized, although the specialized here include emergency milk formula for the prevention of wasting, but it can also include other ready-made foods that are definitely ultra processed. So although I don't have the fine details of that, but we can definitely guess that a part of this is coming as ultra processed foods. Again, with the collapse of the humanitarian food assistance, there was a letter published by, an article published by IFPRI, whereby they were saying that there is an inflow of commercial supplies. I don't have the data. Nobody knows exactly what these commercial supplies are, but Commercial means that people, are using the commercial aspect of this food to make money. Again, a food that should be easily transportable, that doesn't require cooking or preparation. So we can speculate and think that, a big part of this commercial supplies, quote unquote, might actually be ultra processed. And depending on the surveys, between 37 and 67% of the population seem to be relying somehow on these commercial supplies. So what are the implications for health when we talk about ultra-processed food? So when we talk about ultra-processed food, I want you to think of what is in that food, but I also want you to think of what is not present in that food. So what is in there? Salt, sugar, trans fats, saturated fats, corn syrups, high fructose corn syrups, all of which can increase inflammation, increase oxidative stress in the body, and contribute to disease. And these foods do not have fiber, do not have vitamins and minerals. These people who are now in shortage, for food, at least what they eat should have, vitamins and minerals. It should bring some nutrients. So these can contribute to micronutrient deficiencies. It doesn't have phytochemicals that makes our food healthy. So they lack a lot of things in addition to containing a lot of things. So I'm gonna build a little bit on few studies we've conducted that were conducted by our group in Lebanon. So this was based on a sample of Lebanese adults living in Beirut, a representative sample. Adults, okay, so not your age, or the age group of students. And their UPF intake was close to 37% of energy intake coming from UPFs. And what we're able to show is that the participants who were consuming a higher amount of the healthy, minimally processed foods were actually protected against several cardiovascular risk factors, including hyperglycemia, including low HDL, and the metabolic syndrome. So those who were eating healthy and eating less of the ultra-processed food had, a very big protection against cardiometabolic diseases. Interestingly, a study that we just published, I think, last month. So here we looked at mental health, again based on this urban sample. And in that study, the urban adults, so it's a different urban sample, they were taking 25% of their energy from UPF. But interestingly, participants with the highest intake of ultra-processed foods had more than 3 times the odds of having depression. So it's not only health, it's also mental health. You might ask me why. Again, it is related to the inflammation, the oxidative stress that happen in the body, and the lack of things that support our health, our mental health. For example, the gut microbiome. Now, there's a lot of research linking what you eat to the healthy bacteria present in our gut, to how this can affect mental health or health in general. So a very interesting link that I always like to emphasize to the youth, because I know that UPF intake might be high in youth. Again, based on a national study that we did, and this was on under 5 children, aged 6 months to 5 years. Their energy intake coming from UPF was 47% of their energy intake coming from UPF, because this includes also milk formula. And again, you had a significant increase in their obesity risk because of the higher, so those who had a higher consumption of UPF had 1.6 times the higher odds of developing or of having obesity in under 5 children. And this, of course, has a whole story behind it of why it can lead to, problems later on. So building on this, I want you to think of the implications for young children in Gaza or in other war situations. And I want to put this in the context of the health trajectory over life. What determines the health trajectory, or what phase in the life cycle would determine our health trajectory almost irreversibly for life? What is it? Yeah, the first 1,000 days, which includes pregnancy, and the first 2 years of life. So this means, why is it so crucial? Do you know why is it so crucial, this first 1,000 days of life? Because of something we call epigenetic plasticity. So the epigenome has a lot of plasticity that can lead to modification in the way your genes are expressed. So the gene is there, it's either overexpressed or underexpressed based on these environmental factors, including the diet, that will determine how your genes will behave for the rest of your life. So things like cancer, obesity, hypertension, but also psychiatric disorders can come from what happens in utero, like pregnant women in Gaza, but also what happens the first 2 years of life. And this means, and this is called a window of opportunity. And unfortunately, if we look at the war span so far, many children have passed this window of opportunity and will probably, because of what the mom was consuming and because of their intake, that no, it's not going to be, the healthy diet, it's probably most UPF, they will be at a very high risk of developing NCDs and other problems, in addition to micronutrients. I'm not even talking about that. So, as a conclusion, amidst heightened food insecurity, psychological distress that characterize war zones, the increased consumption of ultra-processed food can further exacerbate the health status of the population. So yes, they want to survive, but surviving on these foods also has its own repercussions. So although our research, the data I showed you, did not stem from a war setting, we only can speculate that in war settings it can actually be worse. And these findings highlight not only the negative nutritional consequences of UPFs, but also their metabolic impacts and their mental health impacts. So not also forgetting about the multi-generational impact. And these epigenetic changes can actually be inherited. So they can actually propagate a multi-generational cycle of disease, of poor mental health, etc. And thank you for your attention.
Thank you, Lara. Wow, very interesting.
Thank you.
Thank you, everybody. Thank you, everybody, for attending, both personally, in person, and online. I'm afraid we don't have a lot of time for discussion. Maybe one question or one comment from the audience. I think next time, Samar, we can do 2 hours. No, it's not enough with the internet, Charlotte. With the internet issue. Our visitor.
Thank you. I have a question regarding UPF. How does it relate to Western diet? I mean,
it's a very okay.
Because when you mentioned to mental health impact, we conducted a study here. We fed the mice on high-fat diet,
yeah,
which is actually Western diet, and we tested like mental ability and as well as coordination, which is affecting decision in certain areas of the brain. And we saw the same thing, but
yes,
it was focusing on this kind of diet that's high in fat
yeah,
and high in sugars. I mean, representing hamburger and Pepsi, for example. Not paid by them, but I mean, yes.
Yeah. So UPFs are one of the hallmarks or the characteristics of what we call a Western diet. So a Western diet is a diet that is poor in fruits, poor in vegetables, high in fat, in meat, etc., but also high in ultra-processed foods. It comes, as one of the characteristics of this kind of diet, unfortunately. So I'm happy you also got the same. Happy. So everybody should avoid ultra-processed.
I think we can end.
Yes, yeah. Thank you so much and thank you so much for the panel for this such an interesting topic
everybody.
and discussion. So thank you. We'll see you next time.
Thank you, everyone.